Hey, just in case for those of you that may be watching this at random times, today's July 3rd, 2024, thus the get-up of the 4th of July romper. Dan's also rocking his 4th of July. We're very patriotic here on the podcast today for those of you who are listening and maybe not watching on YouTube. But Dan just got back from a vacation. This podcast, we kind of held some information. We would have liked to get this out a little bit quicker, been a little bit more speed to news on this. But we had a couple of big things that we want to talk about. First, we had, I think we titled this episode, We Beat Medicare. We had a very funny
we ordered hats, right?
Yeah. We're gonna have some merch, and regardless of your political assuasions, that was just a funny moment on a big national stage with
we were texting immediately, and we got blown up from people in groups and threads, text messages, everybody went crazy about that moment.
The funny thing was about that particular clip and gaff and why it was so bad was it wasn't even really necessarily about Medicare, and that it was like Medicare just randomly all of a sudden took a stray punch.
I would love to say that it would be great if we somehow did beat Medicare. It seems like that's impossible to do these days. It's a pretty hard year to beat Medicare, but it seems like, at least President Biden's confident that he beat Medicare.
Yeah, at the very least, it created a very funny soundbite for the industry, which Medicare is usually not talked much of outside of industry specific people. So it was just funny that it made the national headlines in a big way.
Matt, we have these new arms in the podcast, and I don't know what to do with my drink now.
You have to left hand it.
If anybody's watching this and I look a little awkward this podcast episode, I'm trying to.
We're getting used to we're getting fancier and fancier. Matt's doing a great job getting us more and more professional.
Having to figure out my drink here. So
yeah. So we a couple other things we want to talk about. So obviously massive news. We want to talk about the overruling of Chevron Doctrine or Chevron deference that we'd been talking about repeatedly on the podcast, and that's been really interesting and cool to see. Supreme Court, the last time that the Supreme Court was in the news that big was obviously the overturning of Roe v. Wade. But the Supreme Court's had another massive 40-year overturn.
And not to say kind of like, neener, I told you so, but we kind of had been following that for some time. You probably heard from us talking about it.
We did say so. Let's all neener.
We pretty much, we'd been following that, and I was watching every single week for some of the SCOTUS rulings because, candidly, they'd had so many oral arguments and so many cases that were stacking up that they needed to kind of come out and have a final word on. Anyways, only like 1/3 of their cases had been wrapped up, and seriously, 2/3 of them were pending with only 2 weeks left to go. So, and by the way, there's still more that's going to come out over the next week or so.
Yeah. So I think that, people go, well, why now? Well, it's accumulation, as we've been talking about on this podcast, of not just our industry, but many other industries. And we'll jump into it here in a minute, but there's been a massive ramping up of these 3-letter government agencies, specifically with this administration, of kind of implementing law, deferring them to themselves as how they're going to interpret it, and then enacting or basically enforcing these rules and laws.
Well, and the whole idea was, right, that a law is created or gone into effect, and there's always that ambiguity, or it's not very clear exactly what the intent was or what was meant by it. And so with the Chevron, doctrine, essentially it allowed government agencies with experts to essentially, they kind of know best or would be experts in the field or the agency, and that they would be able to kind of interpret those gray areas of ambiguity and be able to kind of rule make and keep the train moving forward. And
Correct.
That was kind of the premise or the thought behind it, which if you think about it it's a sound logic, right? That's a great reasoning or idea behind why that would exist. But I think when you start to look at any law, look at the Telephone Consumer Protection Act. That thing's a piece of crap. It's a piece of garbage that was outdated, and you read the law behind it. People, their telephone ringing, interrupting their dinner, because when it was passed back in whatever year.
It's like 1981 or
it's
something.
It's so outdated. And that's kind of how this was, where at the time, look, we weren't pumping out laws and these sessions like we are in the fashion that we are today, and same with regulation and rulemaking. When this was over 40 years ago, when it was established, there was very few gray areas of ambiguity that these agencies were interpreting and then rulemaking on and moving forward. Now we got to a point where the legislators weren't even involved in the process. It was 100% different agencies. And I'm not even talking just us in our industry with Health and Human Services or CMS or the OCR under HHS. I'm just talking government agencies in general. Just so many of them were like, hey, we're creating this rule. We're making this rule. This is how it is. This is how we're going to market. And that was the whole premise, is that they don't have really the authority to do that. And when you read through that, basically the what do you call it? Like the final ruling or the Supreme Court with that
synopsis, or
exactly.
What's the fancy word they use for it?
I'm not an attorney. The write-up on it that they gave.
Syllabus. That's what it's called. Yeah, yes. The syllabus.
They kind of wrote and summarized that, the judicial system, that they are the ones that really should be involved in that, not necessarily just an agency.
Yeah, and of course the Supreme Court ruled 6-3, usually down more conservative-leaning judges and constitutionalists.
It wasn't 5-4 or anything. Yep. It was 6-3.
And if you go back, it's been really interesting to learn about it. If you're a fan of smaller government, and what Chevron's done is it's basically kicked it back to how the Constitution and the framework was designed, where laws are passed, and then in instances like this, there can be the courts actually decide how to interpret the statutes, right? And that's so this essentially is it's deleveraging a little bit of power from these three-letter government entities, and it's restoring back that authority and power to the courts to go through those statutes, and of course they're going to rule on those things, and they're going to bring in experts. And so what it's basically done, like Dan said, is over the past 40 years we've seen a massive explosion. And, no matter how you feel politically, there's no denying that the three-letter entities that rule our economy, our industries now, have grown in size and scope and regulatory authority. And so this is taking some of that authority away and shifting it back to the laws and the courts.
And it slows it a little bit. We've been talking about it a lot. I mean, on camera, off camera, conversations with carriers, with agents, I was, saying it's just such breakneck pace. I mean, the number of changes that are happening so quickly. I mean, we've talked about there's been more changes to, if you're an agent, a distributor, an agency, whatever, in our business, we've seen more change happen in 18 months than we saw in the prior decade, maybe 2 decades.
Yeah.
In 18 months, it was so fast that you can't even keep up with it. And not only that, if you're well-intentioned, if you're ethical, if you're well-meaning, and you are doing your best to even try to keep up with it, you can't. And so
Correct.
The whole idea is like, hold on, this is way too fast. And so what this will do is I envision that they're going to now start establishing maybe some different little committees or consultancy groups, between our legislators and, in our case, like CMS or HHS, and they're going to advise and seek counsel so that they can properly vote on those matters of ambiguity versus just letting HHS just make the decision for us.
Yeah. So if you, like I'd said, if you're a fan, if you're a more libertarian leaning minded person, you want maybe less government oversight and regulation. You want to have the opportunity for our elected officials to pass laws and then have the courts, debate the minutia of that. I think that you're very excited about this. If you're a big government, very pro regulation, a lot of people of that political persuasion were not very happy about this ruling. But to Dan said, it is a massive fundamental shift. And I actually went through and I made a list of all of the government entities.
Before you go to the list, we'll get there. But the one thing I do want to say also is and again, we try to be really pretty fair and balanced, on this, like this podcast, candidly what we do in all our conversations with agents and carrier partners, but one of the things too that I thought was kind of broken that will now be fixed from this is large entities, and I really am not naming names, like there's a lot of them out there, but what they would do is, rather than, if they have an objective of what they wanted completed or something that would benefit them, typically they would have to go hire lobbyists, obviously kind of create a bill or passage, go to this lawmaker who's going to then sponsor a bill, then it has to go to committee, and then, most bills die in committee, right? And then it has to go pass through committee, actually get on the docket, get voted on, then you're going to have to get a majority and have something go into effect. What's kind of been broken is the fact that a lot of these large entities have been able to completely circumvent that whole process and then just go to and influence some of these government agencies, and not just Medicare and Health and Human Services, but it could be the EPA, it could be whomever else, and all they have to do is win over or have influence within that entity, and then they can kind of get this rulemaking to go in their favor too, which I think has been a very broken or circumvented part of the process for years.
Correct. And it's a sword that cuts both ways, and I don't think it's good to have it on either, a more Republican or a Democratic leaning side of things too, because you also don't, just so happens that the pendulum's kind of swung over on the more liberal Democratic leaning side of things right now, but you also don't want to have it happen on the reverse, where essentially whoever gets into office can just appoint unelected bureaucrats to be the heads.
Put in a czar,
of these things, and then they're able to reshape all of these things and essentially circumvent our legislative process, and that's really what's been happening, frankly, on both sides. And, I'm not going to read my whole list of government entities.
Let's go through them.
But if you think back, I'll even, and there's a million ways that Dan and I could go on this and could talk about all these 3-letter entities, basically, one by one, and some of the changes that things have kind of evolved to over the past 10 or 15 years. But there's a lot of stuff that even was with COVID and some of the implementation and some of the rules and oversights and regulation, where a lot of this stuff that just kind of emerged was due to this type of power and authority that's been delegated or deferred to these 3-letter entities, for better or for worse, right? And so I'm not going to claim this. I had ChatGPT make this list for me because ChatGPT apparently is smarter than I am. But there was 28 3 or 4 letter government agencies that are going to be affected by the Chevron overturning. And you've got obviously the ones that we're talking about all the time, CMS, but you've got like Health and Human Services.
And so people listening, Health and Human Services, CMS, and the Office of Civil Rights, under Health and Human
OCR.
They're underneath Health and Human Services, just for
and it is interesting because we hear about these entities to this point all the time now in politics and discussion. And if you were to ask, I guess the average American, what some of these entities are, most people didn't even know what they existed, or that they existed prior to, I'll even say, COVID. A lot of these entities, nobody was out there talking about the CDC or or the HHS prior to some of these, prior to the decisions affecting everyday lives as Americans, right? But now
people didn't think like that the Center for Disease Control had the ability to somehow make very controversial decisions on my day-to-day livelihood or, decision making.
Correct. Right? But, you start going through these bodies, and you start to see how the regulation and the oversight has crept into all of our lives. Dan and I are of the age where, we basically have lived and existed and felt the effects of Chevron being in, and it's grown a lot of this regulation into our lives. And so you've got like the USDA, the DoD, Department of Defense, right? You've got CDC, CMS, the FDA. NIH has been another big one, National Institute of Health. That's been one that's been hotly talked about over the past 5 years. You've Department of Homeland Security. Look at TSA, and TSA's on here as well. Every time you go to the airport, there's
one yesterday.
Just something else new that you didn't know, where you're like, where did this come from, or this didn't come from? And again, it's all these entities' ability to just.
It's funny because even at the airport, like when you go through TSA now, you don't scan your boarding pass and ID. Now it's give them your ID and we want to take your photo picture. And I'm like, is it mandatory? no, it's not mandatory. Then I'll pass. Here's my ID.
Yeah. They scan your retinas. It's going to be like the Minority
I was just
Report.
gonna say Minority Report. I'm like covering my retinas. Like, don't scan me.
I actually watched Minority Report 2 weeks ago with Cole, my youngest, and I was at that time. It seemed so far-reaching and outlandish. And now I'm like, oh, that's just probably that's probably a couple of years away, before we walk into the store and it scans your retina and goes, how was that last purchase?
I'm like, how many social credits do I have? Let me fingerprint it.
Yeah, exactly.
Yes,
blocks you out of going into the airport that day
because
you posted something bad on the internet.
Now I'm on my rabbit hole. All right,
we're gonna have to get this podcast approved again. We're gonna have to go through the certifications. We're getting good at it
for sure.
Well, you've got the DOI, right? The National Park Service making a lot of rules and changes. FBI, DEA. You're seeing a lot of these administrations.
Is ATF on the list?
Of course,
too?
ATF, all of these ones, the EPA, the Environmental Protection Agency, that was being very, very aggressive. That was the catalyst and the trigger.
It was the catalyst
for this rollback. Of course, you've got NASA and, the SEC, Securities Exchange.
FTC.
The Federal Reserve is on here, the National Labor Bureau.
Do they even count as one of our agencies, the Federal Reserve? Do they count?
We just skip them. We just pretend like they never existed anymore. Okay. So you have the SBA, and then you have, SSA, Social Security Administration. So lots of these entities. So we're in uncharted territory. And of course, it's not like everything on a lot of rules. We're not saying all rules and regulations are going to be going away.
No, but I think the other thing that we need to make sure that people understand too is that when they did write their syllabus on their ruling for this, that they were basically saying, hey, this is for moving forward and more forward looking, that they're trying to limit exposure to, litigants, and they don't want to have a whole lineup of every single decision that's ever been called into question by these authorities for the past 30 or 40 years lined up at the door. So that was one of the big concerns, obviously. And so from the syllabus that I read, they did want to, they made it very clear that it does limit litigants' ability to go after prior rulemaking.
Correct. So. And so it's going to be a slow unwinding of some of this stuff, right? It's not going to have immediate impacts, but it's going to open the door for if there were pain points in industries where there are things that they feel like need to go back and be relitigated or turned back over to the courts. There are going to be challenges there.
And one of there will be some, but not as many as I think the pundits or the people who were not happy with this decision. They're like, oh my gosh, now our court system is just going to be littered with all these cases. I don't think that's the case in rear looking, but I do think there's a couple of lawsuits that are currently on the docket that are current right now, like we've talked about, and they might amend some of their filings and they may change like some of their things because now they have even a little bit more fuel to their fire, a little more ammunition with their cases. Again, I'm not an attorney, but that's just my perception on the matter. The other thing that I think is, somewhat very applicable to us with CMS, obviously, is there's a few things right now that are very recent that are about to go into effect, like some of the Inflation Reduction Act changes and a few of the other things that are maybe in question just because they're not fully implemented yet.
Yeah, they're vulnerable to be challenged or they're not quite baked yet. So this may throw a grenade in some of those proceedings and may slow things down. We'll get into that too. And to be clear, I'm not and I know Dan's not either. We're not anarchists. We don't want like complete, there are some libertarian-minded people where they basically want anarchy almost, but these 3-letter and 4-letter regulatory entities definitely serve a valuable purpose, and we just think this will be good for the industry. Slower regulatory process is going to be a result of this, and then there will be some reclarification of ambiguities that'll be kicked back to the court, which I think will be good. And again, going back to the catalyst of why this finally happened and why now, if you just read, we were very frustrated. Like I was extremely frustrated with the call letter this last year. A lot of us, we've done 2 episodes and we mention it in probably 20 of our podcast episodes in just how tone deaf the administration was, or I would say that Health and Human Services was, when you look at the call letter and you would have
commenters, and we keep saying, and a commenter would be a payer, a carrier, somebody that's very high level, or maybe their legal team, or somebody who does their stars, or who actually does the plan bids and filings. These are not just, tinfoil hat people that have an IQ of 40 that are just making stupid comments. These are very respected and knowledgeable professionals who are pushing back to the call letter to say, hey, we're concerned about this timeline. We don't think this makes sense. We want clarity on this. And they're making these very valid, we want more clarification, X, Y, and Z. And the response back from CMS in this last year was pretty much, too bad, so sad, this is what it is. I mean, really, and just do as I say. There wasn't a lot of rationale behind it, reasoning, logic, evidence. And so I think with this Chevron, being overturned, now whenever there's going to be something that's required or implemented, they are going to have a whole lot more of reasoning, as they go to market, so to speak, or as they make those changes. They're going to have to be very clear on what it is, what the intention is, what the purpose is, and the why, the implementation. There's going to have to be a lot more specifics and not as much vague details without a lot of intention.
Correct. And I think that's great. And that's going to be one of the byproducts of this is more regulatory stability, because that's what's good for the industry. And when you're talking about a healthcare system that spends $4.1 trillion on the American healthcare system, where we're making these changes at a breakneck speed, I think it does make sense to have a little bit more forethought and prudence to go through and look at these things and the downstream workflow effects of a lot of these changes that are happening, because we are not just Agent Boost, but every carrier, payer, healthcare system, doctor, agent, beneficiary out there is living and breathing the effects of these downstream effects in real life. We've been talking about these things repeatedly over the podcast.
Yeah, and another one just to keep your eye on too. That's I think they're supposed to rule on this week or next was the versus Becerras. Another one, the hospital systems and the hospital payments. That's another one that's already been heard, and we're just kind of waiting to hear the final ruling and the syllabus on that one. But that's another one that definitely impacts our industry, is those hospital systems and the hospital payments. Yeah,
and so I think we could belabor this point with the Chevron and talk about it for hours and hours and hours, and some of the different potential policy changes that are going to come. But we do think it'll affect things slowly. But let's talk about very specifically, how is that going to affect what we've been talking about on the podcast for the past couple of months and weeks, specifically related to, a couple of weeks ago, Grace talked about on the podcast some of the legal challenges and things like that, and where we're at and where it's caused a lot of paralyzation in the industry is like compensation on the FMO side and things like that. And then there's been some legal challenges, and now you have Chevron struck down or overturned. And I think a lot of these lawsuits are going to go, see, what I'm basically saying is what we're talking about. And that was already overturned.
A lot of the lawsuits there was way too much overreach, and that's basically, if you peel it down to something you give the Cliff Notes version, is too much overreach, right?
Yeah.
And so candidly, they have more firepower behind
them. Yeah, and pointing and saying, see, that's about the extent of my lawyer legalese to precedents. It looks like the Supreme Court setting precedent or something. I don't know how you'd construe that to be in your favor, but I definitely think it'll impact that. So what does that do? I think now it kicks it back more to the carriers, and they get to just decide how do they want to go with things anyway.
And to kind of give more of an overview, I had a call today with a carrier partner, and essentially we have calls with some of our different carriers or payers, and it really depends on the cadence. Some of them we have a call weekly, some of them it's bi-weekly, sometimes it's monthly. But the reality is we frequently have touch points with a lot of our, we're a vendor for them. So we have recurring calls about expectations, about our contractual agreements with them, about what we're executing on. These are pretty normal touch points that we have. And I had one today where I just said, look, I just quite frankly don't care at this point. We're almost to where everything is secondary, tertiary. It just doesn't matter, because until I can get an answer about what services were supposed to be performed and how we're supposed to be. We all hear that you're saying you're working it out and figuring it out with your legal teams, but until you figure it out, we're all just in paralysis. We're all just sitting there. I just said, I'm a boat out in the middle of the ocean just floating around with no direction to go. You know, It's like we can pivot and we can go certain directions and we can move, but we don't even know where we're going right now. And so I think that that's the biggest thing that, you know, for anybody listening, if you're an agent, if you're an agency owner, if you're a payer, if you're a regulator, we have a broad listening audience these days, is that the industry at large is pretty much in full paralysis mode. We don't know, you know, again, where do we spend and allocate our funds? What's our growth strategy? Is our new contract going to be forward-looking, rear-looking, per app basis because of this safe harbor? Is it going to be, we don't know. So I'm just kind of sitting back here going, that's cool. You got a whole list of things you want to cover as a vendor and you want to go through a checklist of 10 things. Well, why don't you, are we a vendor? And are we going to get paid as a vendor and how? Because until you figure that shit out, excuse me, pardon my French, until you figure that stuff out.
Mom doesn't listen to this podcast. It's okay.
We don't have a whole lot to talk about yet. You know, we have nothing to talk about. So why don't you figure that stuff out first, and then you can shake me down for performance.
Yeah, exactly. Well, not only that, but, you know, right now is the time where we're actually strategizing. We know where there's going to be a lot of massive disruption and opportunity. Oh, and by the way, there's another small regional carrier that's exiting the space that we're not going to.
Oh, we can't say who.
We can't say who. But another small regional carrier that's going to be exiting and leaving a lot of members. They're getting out of Medicare Advantage specifically. And there's probably going to be a few more of these that drop over the summer.
So this one was like 30-something thousand members, just as a heads up.
Can't say, but news will be leaking out or coming soon on that.
Go look into. You can look into the CMS data that they post publicly and look for the entities and organizations that have around 30-something thousand members and go eeny, meeny, miny, mo.
So there's going to be lots of disruption and many beneficiaries that are flat out losing their plans, costs exploding, SARS, where they're going to have to choose a new plan, and brokers are going to serve that need. And we're out here trying to deploy our marketing strategy. Yes, we want to, you know, as a business get more enrollments, but we also want to help serve that population. But we can't really right now because we don't know, do we have marketing funds? How are we going to service those? How are we going to market out? How are we going to message to those people? When and where and how can we do that? And we're already, you know, about 2 months behind in the year cycle for these type of planning. So just one thing is we're waiting for a big dog or two to show their cards essentially.
Well, and to clarify what Mike says, it's not like we're these incompetent idiots. We absolutely know that we can't communicate to beneficiaries until October 1, right? Yep. That we can talk to agents, and if you have an NPN, that we can provide you with information on plan disruptions and X and Y and Z, but we need to protect those first looks or data behind a login so that just normal people, like the public, the general public, can't see it. We definitely know about that from a compliance perspective. And again, that October 1st start date. So we do know all those things, but what he's alluding to is, you know, how do you know if you're going to have even a marketing budget as a company, like from an economics perspective, when you're starting to plan out AEP, how do you know like what your budgets are and where to even, okay, do I have any dollars to spend to target a disruption in this area? There's these consumers that I know are going to not have their health plan, but what are my dollars like? And can I even go target those areas? Because I don't even know what the compensation plan looks like.
Correct. And obviously I wasn't alluding to the fact that we're going to go to the market early with, you know, information that we can't or shouldn't, but what people need to understand is it takes a couple of months to set those wheels in motion, where if you're going to do mailers, you know, for example, you've got to identify those zip codes. You've got to prep the mail house. You've got to, you know, get compliant pieces covered.
Exactly. So you have to, we're talking about it like a vendor. It's a election year. And guess what? Like a vendor that we use actually marked up their services 15% and then just said it's up 15%, because we pushed back and said, wait, why did our cost why did it go up this much in their election year? It's what it is. Really? Because if you don't want to pay this price, we're going to stick you to the back of the line, and we have so much super PAC money from all these different campaigns that they'll pay this rate. So not only did it go up 15%, but then they are full to capacity. And so you have to get your pieces prepped, to Mike's point. And then all these payers or carriers, we have to send over the marketing pieces to all them for Medicare to get them to opt in or approve. That process doesn't take a day. Some of them are pretty slow. And so you have to get that piece approved, get a deadline over to your vendor, get it by a certain time. I mean, there's a lot that goes into it.
And that's just on the physical side of things. You know, if you're going to run digital ads, you know, you've got to do the same thing on a digital portion, get those ads approved. And then a lot of times there's learning phases and you're not able to deliver. So there's all sorts of things that we'd like to be working on.
Or digital, where your ads get blocked because we're selling a product that's health insurance, and it's the regulatory body is Health and Human Services, or CMS. And so ads get flagged for election interference a lot, even though they're not. They're nothing to do with elections, but because you're talking about government subsidized health products or other things, the algorithms within a lot of the social platforms just flag them, and you have to go through manual reapproving processes.
Correct.
And it takes a long time.
Well, not only that is, you know, a lot of brokers don't have access to the inside information, and they don't know too. So there's an information supply chain too that you've got to disseminate, you know, the changes and the disruption down to the actual feet on the street brokers that can help people and make a difference. And that all takes some, you know, a lot of time and effort and logistics as well.
So, I mean, Grace a few weeks talked about the game of chicken that's happening right now with the different carriers or payers. And one thing that we've communicated to a lot of them is it's like, hey, somebody needs to blink and somebody needs to go, because at this point, there are some larger entities or carriers out there that we think are not going to, you know, go to the market. Because right now, if I'm a big player and I go to the market and tip my hand and say, hey, this is what we're going to do for like FMO compensation, and this is what we're going to do for our different vendors and X and Y and Z, then now that gives all of their competitors plenty of time between now and, let's say, you know, end of September, for them to come up with an alternative version of that and to come up with a game plan and to change and to strategize. And so I think at this point they don't want to do that. And so to anybody listening, I think now we're just in this stalemate to where they have a lot of leverage and they're holding cards, and now they're just, you know, going to wait until some of these bigger carriers out there, I do not think are going to really show their hand and show their strategy until mid to end of September, right before crunch time, to intentionally give the small to mid-sized players absolutely no time to react and come up with an alternative strategy.
Yeah, it's a very interesting thing we've said about the game of chicken, and for some reason, and I can't really quite make sense of it as to why everybody is so terrified of being any sort of an outlier, having any sort of a different sort of read or take in the current environment. Because
why not just say, hey, here's our release date, and the date is August whatever 1st, and as of now you're a vendor, and here's what our plan is, and here's what we're planning to pay you. And if we need to update the terms or the arrangement, then we'll send you an amendment, and we'll draft that amendment, and we'll put that into. So just do that.
Yeah,
I don't understand what's hard with that.
Or we're just going to keep it status quo until we officially hear that something, you know, has got to change for one reason or another. But yeah, everybody is just paralyzed right now, and so it's causing a lot of.
Well, it's a supply chain too that people don't understand. Is right now, you know, you have to look at HHS or CMS, then down to the carriers or the payers, and then from them they go to like FMOs or distributors, and it's basically stuck there in the supply chain. So from there you have all the mid-size agencies and smaller call centers and everything else, all the way down to the street agent, to then the consumer, right? And so when you look at that whole supply chain, it's just kind of is stuck there, kind of in the middle, just sitting there.
Yep, big log jam right now. And it's like, you know, I will say, if any of our carrier partners out there, well, I know a lot of you listen, just go. No. Just show your cards, because we already have some carriers and smaller carriers that are doing that, and it kind of is breaking down the lines of, are you a carrier that wants to grow, or are you one that keeps kicking the can down the road this year because, you know, you're not necessarily in growth mode and you've got some other things to figure out.
We want to grow. Yeah. Wink, wink. Like we want to grow here and there, but not there. Nope. I just keep thinking of that, like, show The Accountant with Ben Affleck when he's like, Yep, you're getting hot. You're like, yep, there you go. Like certain areas we want business, but others we don't. It's like, I mean, come on. You got to start being a little more specific, and you got to start, giving us a little bit more clear direction. Yeah, we're nimble, but we can't move, at the flip of the switch.
Yeah.
We got to have 60, 90 days to kind of implement a strategy, not a week.
Yeah, well, let's maybe we can kind of shift gears and move on from that, because I think a lot of our and industry issues aren't necessarily affecting, some of the agents, or at least they don't understand
indirectly.
They
it's
are
not
indirectly.
directly affecting them.
It's like, well, stop talking about your pay. I already know how my pay is going. So let's talk about that. So the other thing that's come out in the past week since Dan was gone was we have FMV, fair market value for 2025, officially announced. And just like we, again, suspected, they codified or just put into effect their hypothetical numbers that they'd put out in the call letter. And
I was right, by the way. You didn't get much of an increase other than that 100.
Well, they kind of construed it as a big raise, because they added it was like 2.5%, so it went up like $20, and then on new. 2.5%. And
by the way, 2.5% doesn't cover inflation. For those of you who are math whizzes out there.
Yeah, so it went up like $7 on a renewal plus the 50 that they stripped away all these other things, and then they added that 50 in on renewals. And again, it says in here up to, so I guess the carriers could elect to not pay that much. But the way that FMV's gone is for a new Medicare enrollment and a new Advantage enrollment, and a new is determined as they don't have anything prior, right? So there's nothing in their CMS file. There's no PDP. There's no Advantage plan.
Remember, auto-assigned PDPs that you move to an Advantage plan doesn't pay new.
Well, it will if you write a 1-1 effective, but if you write it during the rest of the year, they're able to prorate it, so they can jip you out of the
Medicare commission,
the true up bonus. So with the true up bonus, it's $726 on a new to Advantage, and it's $805 in Connecticut, PA, and Columbia.
Hey, by the way, I'm just going to keep posing the question out there. I don't understand why it's still higher in those specific states, because if you really look at cost of living and adjustments in all these other states, that was like from 20 years ago.
Maybe longer.
It's not even relevant anymore. Some of the cost of living things have shifted so much. When we're talking about a world and an environment of fairsies and samesies, why is it that those states get more?
Correct. Yeah, I mean, it's a valid question. It's always been bewildering, and then you've got California and New Jersey at $880. And
if anybody listening in the comments can educate me as to why those states get more dollars per sale there, I would love to know.
Yeah, show me, extrapolate out for me how living in New Jersey somewhere is 15% more expensive than living in any of
I don't know Washington in Seattle or
our backyard now,
Austin, Texas,
Austin, any of these hot markets across the country. It's it makes no sense. But hey, that's a topic for a different day. Renewals going to $363.
So remember, I had a lot of agents asking me in groups and threads and forums too. Those numbers do account for and reflect the FMV increase. So obviously, the whole goal was, well, we're going to take away the HRA or the VBE payments, all the gas mileage reimbursements, the co-op for agents, all those other alternative, the quality,
the marketing bonuses, the retention bonuses,
the Humana MRP dollars, all those other forms of payments. We're going to strip those away, but we're going to give you that add back, so to speak, or give you the $100 boost on commissions and the $50 renewal. Those numbers include that. So there's no more extra 100 or 50 on top of that. That number includes it.
Correct. So these are all in numbers. So this is no more HRA, no more anything else on top of it, all in, right? So that does extrapolate out to $30.25 per member per month on renewal.
And remember, for all of you math whizzes out there, how many of your enrollments actually pay you the full amount? It's going to be your 1-1 apps. Some carriers pay through March, but then anything 4-1 or later, it's prorated. Anything that's a PDP that already is, even if it's an auto-assigned PDP, it's the first time on MA. First time you write it, it's prorated. So the amount of policies where you actually get that extra $100, which has been my counter argument to a lot of people, it's maybe on 20 or 30% of your sales of your business.
Correct. Well, and I think this reality is starting to hit home for a lot of agents because HRAs had creeped up there in prices to where most of them were at the very least $80. And the ones that were only paying $80 were paying some sort of other additional,
Right.
like Humana, an MRP for good agents and things like that. And so the reality of the situation is starting to take effect for some agents where they're not going to have these ancillary amounts. But I do think if you're an agent out there that has a good book of vested business, and if the carriers make that decision to increase FMV to the 2025 rate,
Which they will.
Yeah, which I suspect they will. And if you've got a book of 1,000 clients and now you're making an extra $5 per member per month on them,
Well, that's true. I didn't mean on new business,
Yeah.
yes, but what is not clear is whether or not how many of those carriers are going to take that legacy block of business and increase to the new FMV rates.
hopefully all of them. It usually only takes one before they all start doing it, unless they all decide, hey, let's not. But hypothetically, let's say that happens and you had 1,000 clients on the books, and now you get an extra $5 per member per month renewal on those. That could be an extra $5,000 a month or $60,000 a year in renewals, which would be fantastic if you're a good agent. But again, I don't know what percentage of agents have a book of 1,000 clients.
If you are, and they do have those good policies, I'll tell you, vote with your dollars. Then be a good agent partner. Anyways, I think that's one thing that is very much TBD on that, right? On FMV. Should we want to talk about the next 6 months?
Let's do that, but real quick, let's talk about the big increase on the PDP compensation.
Oh my gosh.
Because
for what point?
Yeah, I mean, a lot of agents are reaching out to me like, they're thinking they're going to be PDP salesmen now because they increased.
Well, tell me you hate Medicare Advantage without telling me you hate Medicare Advantage. So you get a 2.5% increase on Medicare Advantage commissions, and then you blow your PDP commissions, which if you talk to all the carriers out there, ain't nobody, cashing checks making a ton of money off of offering standalone PDPs, right?
Yeah, I mean, I do think that the PDP standalone commission only has been pathetically low to the point where it's like almost don't even track it. It's not even worth it, because it's been so low. But they did raise it, so I'm curious. I think a lot of PDPs or some PDPs may go non-commissionable this year.
So remember, there's all these constraints already with these carriers and with the Inflation Reduction Act and trying to follow all those requirements and, the economics of having to cover prescription drugs now on the front end that they have to, that the carrier now has to pay, not the consumer. Already there's some financial constraints behind doing those PDPs. So now CMS is saying, hey, now for the sales reps that do sell those products, the commission, I forget what they are in 2023. What are even PDP commissions in 2023?
For last year?
For this year, like
2024.
Well, yeah. So sorry for 2024. That's what day it is.
I think.
What day is it? October?
It's $78. I haven't.
So to go from like $78 to like $200 or what is it now?
Yeah, 78's the renewal. But it's going up to it's going up the initial year is $209. So if it's
$209,
brand new $209, renewals are going to $105.
How can you squeeze in a $209 agent commission into the economics of your PDP? That's already not very profitable.
And I mean, really, the only time agents are writing an initial year PDP is if someone's turning 65 and they're pairing it with a SUP.
Yeah,
So
sure.
that's really the only time you're going to get it. But the renewal on PDPs is going up to $105, and I'm still going, well, that's still 3.5 times. An MAPD on renewal still is 3.5 times more compensation on that. So agents don't get lured into the siren song of thinking you're going to be a PDP.
Well, not only that, because you typically are having to pair that, like you said, to a supplement, which is also going to have huge major price increases. So most of them have already increased their prices by 25% without looking at just on utilization, not even factoring in the OCR ruling and if that stays as is.
Correct.
So they're already up 25% on their premiums across the board, not any specific carrier. So if you're finding people that just are flush with cash in this high inflation environment and just love paying for those, and and they also, I think your PDP premiums are also going to be a little steep next year. Ain't not going to be these 50-cent PDP plans next year. Those aren't going to exist. So, I mean, again, I think you're right that I think we're going to see many plans like, hey, this Hicken is going to be non-commissionable. This one's non-commissionable. This one is commissionable. And I think you're going to have a crapshoot of the plans that are commissionable versus not.
Yeah, and one concern I have is I always run across agents that think that, hey, it's pretty easy to write a PDP plan, and it's pretty easy to requote somebody on their drugs and write them on a cheaper PDP, and I'm going to make $100 on that now, and that sounds like a good idea for me because it's an easy sale, Right. And I'm sitting there going, it's a lot of work to do a good job of quoting. It's almost as much work as enrolling somebody in an MAPD, and I know that you're going to have a bunch of agents with this current PDP environment that think it's a good strategy to be PDP focused agents, and I just don't think that's going to be a winning strategy for a lot of you out
I'm
there.
already calling it. We're going to see an uptick in CTMs on PDP sales.
Yeah, so just but overall, hey, it's good. That's a good increase there. I think we'll actually benefit a lot. We have a many vested policies to the house on renewal, and so we'll get a bump in
hypothetically.
As long as that happens, we'll get a good revenue bump hopefully there.
I tend to be a little more cynical that a lot of these carriers are probably not going to be paying at the new FMV rates on vested business.
Yeah, I think it only takes one, and then a lot of people have to follow, because then it's like, well, we kind of saw that in the industry.
So what have you done for me lately, business though?
That's true. So. As well it should be. Well, let's kind of wrap by talking about, I had a whole bunch of Health Sherpa stuff and updates that we could get into. We'll have to save that to next week when they
let's do it.
Make some other changes. But
you already tipped your hand. We'll have them on the podcast here again in a few weeks.
Oh, I was going to talk about, there's some changes to the, like the 12-hour login and FFM and why.
That's fun.
And again, that's all CMS, mandated change stuff that we're talking about that's affecting ACA and all these other downstream entities. But we could,
don't shoot the messenger.
Yeah, we could go into that, spend an hour talking about that. But let's talk about, since we've been talking about agent comp and the new FMV, Dan basically said that this next 6 months is going to be the lean times, lean.
Two things. I want to talk about that, but then I am going to end on a very positive note, just so that everybody knows. So I will say I did a post in our Facebook group. I don't know, Matt, you should put that in the comments too.
I always have. The Facebook group is in the comments, by the way. Join our Facebook group. It's good, but we need some. We've lacked a little bit on growing that Facebook group.
We've been starting to do the podcast for all those of you who are listening. I felt like the reason we've put so much time and effort into the podcast is because I do think that we're a more knowledgeable entity out there in our industry. I think that we definitely know our stuff, so to speak. I think that we very much do a great job of training and empowering our agents. But what I do think is we lacked in kind of creating some of our structure and some of our groups and our community with our agents. So we do have a Facebook group, and you'll find some very high acumen people in those groups. I just started selling Medicare 3 months ago, and I think I know everything.
Yeah, there's a lot of groups like that where it's like the answer board.
We have some really high acumen agents who sell.
To be fair, we do have a very amazing, robust Slack community where actual real good agents are helping and sharing and celebrating and teaching. And and all of our Agent Boost staff are in our Slack channels as well, answering questions and helping our agents. But
we did start a Facebook group though externally, so even if you're not aligned with us, you can join that Facebook group. Anyways, we think that it's valuable, and there's a lot of great information there. So if you want to join the Facebook group too, the link will be on this episode for you to join that Facebook group. I put a post in there today about this and saying I think these next 6 months are the most challenging for a brand new Medicare agent that I've ever seen ever since the inception of Medicare Advantage. And the reason that I say that is because we all have been hashing out the call letter for next year, and we were just talking about FMV and agent comp, and we know that while they took away some of these compensation mechanisms for agents, they kind of gave them the add back of increasing the FMV. Well, that kicks in for applications that are a 1/1 effective next year. But the reality is right now for a new agent or a newer agent getting into the business selling, Q3 and Q4 of this year, you have prorated commissions. So, you start selling these 8/1, 9/1, 10/1, 11/1 apps. I mean, you're getting like $44 commissions per sale. You're getting these very small commissions.
Prorated commissions is one of the worst things that happened to a new agent getting started in this industry.
100%. It is so incredibly challenging. Even if you're a new agent and you're writing 10, 20, 30 plans a month, it's pretty hard to pay the bills.
Like, here's your $300 for the month's worth of work.
Right? It's pretty hard. Yeah. It is. So you have all these prorated commissions, Q3 and Q4. Then you enter into AEP, which is the great time, right? It sounds good, but obviously because they allow these carriers to not pay agent commissions until January, you have to work the whole fourth quarter selling 1-1 apps, and you don't get paid until January. And I will give a shout out to United Healthcare. They've always been the best and the quickest. You can see in your commission statement, like, your future earnings and what you will get paid. And right on January 2nd, you're deposited that money from United Healthcare. They're the quickest. I've seen other carriers not even pay out until March. And I'm not kidding. March until they pay their AEP commissions.
And just so you agents know, that's not on the carriers. The carriers would pay that out. It's a CMS requirement that they cannot pay $1 of plan year money until that it's actually in that plan year.
Correct.
So it makes it hard.
And so because of that, look ahead these next 6 months. I'm brand new. I'm pumped. I get into this business. I start selling. I'm getting these prorated commissions right now, and then I enter into my AEP, my good time of year. Then I don't even get paid anything for my effort and before, you would have these VBE or HRA payments or co-op marketing and other things that would kind of have these alternative things like, hey, maybe, I have a prorated commission, but I did a VBE with each one of them, and I have cash in my pocket now to keep going. All the carriers have started to remove all those. So even though it's not required now, they're all kind of taking full advantage of the moment to say, hey, in order to get in line with these new regs from CMS, we're going to stop paying HRAs or VBE starting June 1, July 1, August 1. So we're already seeing this cascade of all these carriers who are halting paying for the VBE or HRA. All the carriers are also, that I've been talking to, been very hesitant to do anything for co-op marketing funds for agents. And so now agents are also being penalized because they don't have the benefit of higher, FMV payments or commissions, and all those alternate funds are also being taken away from them right now. So it's just the ugliest landscape that I've ever seen.
Yeah, and so I think what prompted this was we got an email from Anthem or Elevance today saying they're stopping the HRA payments. Aetna's already, they were first to say
they shot their shot.
Like, they were like, oh wait, what? We cannot pay those? Yeah, we're killing that now, And those were gone. Has anybody else officially? I think did Humana come out and say they're not?
I don't know specifically, but you're going to start to see the cascade because as one goes and the other goes, and you're going to start seeing more and more. And obviously they can pay until through to 12-1 apps, right? I mean, if they wanted to, they could. But I think, again, it's like, well, hey, if we can.
And to Dan's point, I think there were all these other dollar amounts, the mileage reimbursement, the marketing reimbursements, the MRPs. To my knowledge, I don't really know. I can't think of any carriers that are still paying that stuff actively.
So Select Health had a thing. They're local, like a regional carrier here in our backyard. They had a bonus of $100 payment, like a start.
Marketing reimbursement, yeah.
Yeah, they ended that, though, it's saying it's ending 10-1. So, I mean, in theory, with CMS, they could keep doing it for 11-1 and 12-1 and carry it through. But I think for a lot of carriers, I'm predicting that most carriers are basically the AEP sales season or window starts 10-1.
Correct.
And the majority of the apps, not all of them, but the majority of the applications written then are going to be for 1-1. My prediction is that all the carriers in the next coming weeks are going to send out communications and say that, 10-1 is kind of like your cutoff line, that they're going to stop paying HRAs and VBEs, I think.
And it makes sense that, there's two reasons prompting it a lot. Obviously, we've talked many times about the funding environment, and so carriers are trying to sharpen the pencil wherever they can. But there's also a operational component too, where they just want to get into alignment of how things are going to be in the future, and why keep doing things or spending money to administrate or sending out payments if you already know it's sunsetting and it's already coming to the end of the road. So,
but just prepare, just kind of warn you agents out there and agencies to, from a cash flow and from a business management perspective, that you're getting your house in order and that you can plan that, accordingly.
So let's, you want to end on a positive note, and let's talk about, don't let that scare you. Find a way to make it happen in this industry, right? So there are a couple things that you can do. If you're a new agent getting going, maybe you can sell some ancillary products, the Allstates, the GTLs, the things like that are going to put some cash in your pocket right away, that are great products, easy to sell, high cash, maybe some life insurance. I think, most agents, especially if you're new, you need to be careful. A lot of agents try to be the jack of all trades, master of none, right at the very beginning.
Here's the other thing I would say too. A couple of things. I really do want to end on a positive note because, for the record, our organization, I can say this right now, Agent Boost Marketing is going to have a net growth this AEP. Yes.
I think it'll be our best year ever. I'll go on record.
So obviously, I'm not down on it. Oh my gosh, the Chicken Little and the sky is falling. Because if you hear our podcast episodes, we're focusing on all these critical things more to bring awareness so that people can plan for it. It's not that I'm this Debbie Downer all the time. It's positive. We're going to grow significantly. And so I think that's great. But you all who are listening need to do the same thing in a microcosm to your own businesses, where right now you should be prepping for even this disruptive sell season. You should be getting your certifications done now. Yes, I know we all want to party for the 4th of July, everything else, but come on. We're all ready to blow up some shit, light some fireworks this weekend, but get your certifications done. Do it now. Start building your marketing plan and actually start knowing how much cash flow you're going to have. What vendors are you going to use? What are your deadlines? Start getting your clients in order, figuring out which of your clients are going to be the most vulnerable as far as impacts. Start tagging them, creating communication campaigns to your members. Start building your Sunfire profiles and getting them built in there. Get your CRM up to date. You can start doing a lot of things right now to prepare yourself for a really disruptive AEP. And probably the biggest thing that I'm going to continue to hit home for agents out there is use the time from October 1st to October 15th, which is that pre-sales period, to really do as much as you can of your service work with your current clients.
Yep, that's what I was going to say.
Mm-hmm. To say, look, it's very disruptive, but you have a relationship with those people. They know you. You're their trusted advisor, or you should be at this point. They're a client, not a customer. And you have that relationship. If you've got 200, 300 people impacted by this, you should absolutely knock it all out, be very efficient, do all of your service work in the first 2 weeks of AEP, and then you can prepare.
And when he says AEP, he means October 1st through the 15th. Of course, you can't take an app. We're not saying take an app, but pre-tee up and solve that customer service
That is
stuff.
that pre-enrollment period that you absolutely can present plan, have discussions with people, go through the game plan with your clients so that when you're ready, you can quickly complete their enrollment into whatever the new and appropriate plan is for them. And by the 15th, 16th, 17th of October, all your service work is done. And now you can focus the rest of that sales season on referrals, on growth, on executing your marketing plan. That's going to be absolutely key this year.
Correct. Yep. I'll just add on 60 seconds. I call it triaging your clients, right? So if you've got a book of business, you're going to, make that hierarchy, that triage of who has to move, right? Your SARs, your people who might be in a service area reduction or a plan just major degrades benefits where those clients aren't going to be happy. Who are the next most vulnerable that you need to move, and organize your blocks of business in that way, and then go to the, may need a review type of thing and handle those people first. And then once you've done all that service work in that pre-AEP, that October 1st, and then again, if you need any apps that actually need to get written, you can do that after the 15th. Use that first part of annual enrollment, take care of all of that, and then go into growth mode, go into acquiring new business, growing your book of business. And that's how smart, savvy, sophisticated agents grow and maintain massive books of business, is by triaging and doing their customer service work at as early as possible, and then maximizing those precious weeks during annual enrollment.
Mm-hmm. Absolutely. So it's going to, and we'll do more episodes just so that you all know, with more content too, updating you all with tips, tricks, what you should be doing, what you shouldn't be doing in order to have a successful AEP. So you'll have more little quick how-to videos, and we'll have more boot camps here. If you're one of our agents, not one of our agents, we don't care. whether you come out to our Tampa location or Salt Lake, plenty more boot camps and training opportunities between now and AEP.
Yeah, if you're either in the podcast links in the description or if you're on YouTube, look below. There's actually links in our description that link to our training calendar. You can go to our website. And again, like Dan said, even if you're not one of our agents, just come, meet, learn. I'll give a plug, especially our boot camp that we do every month. I feel like that is as quality and good as a lot of these universities and training programs that a lot of people charge money for. I think you'll learn more and get more value out of those, whether you do business with us or not. And I think you'll really be impressed by the training and up-to-date information we do there.
Yeah, absolutely. I know we've gone a little bit long this time, but before we sign off, I think I want to add that, hey, we love the business that we're in. We're very patriotic today. We're excited about the 4th of July weekend. Again, love our industry, love everything, everything that's happening right now, I think is very much positive and on the up and up.
Correct. And the Chevron's great for our industry, guys. Like there's been some big wins.
I think we're past maybe some of the ugly stuff. And I think that we see a lot of opportunity from here on out. So, and remember to like, subscribe, comment, ring the bell, whatever. We want to continue to grow our audience and grow our reach. Comment too. Comment on all of the platforms, especially YouTube. Tell us we're doing a good job. Tell us we suck. Whatever you think, we like to read your comments. There's been some smart comments there. Yeah, and we actually have increased now that 91% are not subscribed, but we have 9% of our listeners now that do subscribe. So we really appreciate it. And we've gone from, I think we've added 4,000 subscribers in just the past 6 weeks.
Yeah, so thank you for that. And if you're still out there lurking, please subscribe. One of our carrier partners I talked to today said he finally subscribed. I'm like, okay, How many times did it take to listen before you finally subscribed?
Yeah, and you'll see there's going to be some value for subscribers built in here in the future.
Got some good stuff coming. Appreciate you guys.
Hey, have a wonderful 4th of July. Go America.
Or hope you had one when you listen to this.
That's true. Go America.